Hey, it's Dr. DeCoteau from Talks with Dr. D, and I've been asked to talk about my experience with breast cancer. I was diagnosed, as every cancer patient who will never forget their date of diagnosis, on December 3rd, 2019. I have a history of non-cancerous masses called a fibroadenoma, and figured I could delay my ultrasound and mammogram. I was going on vacation to one of my favorite places, Martha's Vineyard. I came back and did it, and it was abnormal. I spoke with my mother, and she basically said, "I've had it, don't worry." I scheduled the biopsy, ultrasound guided biopsy, the day after Thanksgiving, figuring I'd have time to recover and bounce right back into work. And unfortunately, that Tuesday, my surgeon called me to give me the diagnosis. I lost it in the office. My colleague, who speaks 5 languages, basically asked me my diagnosis, which was HER2 positive, ER/PR weakly positive, stage 2 breast cancer of the right breast. And he told me I was going to live. I knew that my life was going to change forever at that moment. One, being a healthcare provider as a board certified podiatrist, and I do cases at the hospitals, I have colleagues, and they looked at it not as a patient, but as one of them. And I knew that there would be certain privileges afforded to me because of the connections. I was blessed to have a great female team, my OBGYN, who's one of my dear friends, my hematologist, oncologist, another great friend, my other head oncologist, a colleague, interventional radiologist, a colleague, and surgical oncologist, a colleague. Plastic surgeon was a great man. I love him, and he made the process pleasant. I remember having interviews with the hospital for privileges and wearing a wig so no one knew. I started chemotherapy, 6 long sessions of Taxotere, carboplatin, Herceptin, Perjeta. I wouldn't wish it on my worst enemy. It was every 3 weeks, 6 cycles. I would go from feeling like crap to feeling great all over again. Stomach aches, diarrhea, cramps, hair loss. I even did cool cap, which is a procedure to preserve your hair, the hair follicles. And not much research had been done on patients of color, particularly African Americans. So I was also a test dummy for that. I lost my processed colored relaxed hair and kept my natural hair and looked like, I'll use a reference for those of that age group, George Jefferson. I had a break and I had a lumpectomy for the affected side, and God was good. I was negative. My pathology came back clear. All this happened right before my milestone 45th birthday. And I remember having one of my last virtual birthday parties and heading directly to the hospital by myself because guess what? I was going through COVID with cancer. And no one could tell me what was safe. Should I go with people? Should I not go with people? We simply didn't have enough information. That day, the day before my procedure, I had a sentinel node, which is a dye injected into your areola, your nipple, to have dye go to your lymph nodes so they could detect if there was any cancer lingering there. The day before my birthday, I had the successful surgical procedure. I recovered, and then I continued starting radiation, 21 cycles. And it was like going to your favorite bar and knowing everybody, because 5 days a week, I was there. That went very well with limited side effects. Then I had another break, and I went back to doing hormonal therapy, the Herceptin Perjeta portion of my chemotherapy, which went much smoother than I expected. I also was determined that I had a non-cancerous mass, once again, a fibroadenoma, which many women of color, African American, are susceptible to. I was very nervous and therefore requested them to take out that mass on the other breast. And my plastic surgeon was there each time. I did not have a mastectomy, as my success rate did not go up significantly by doing that. I had lumpectomies. At this point, God is good and I'm doing well. I do get some of the side effects of chemotherapy and radiation, some of the discomfort in my hands, and tamoxifen at the dosage, standard dosage of 20 milligrams, I just could not sustain, and they reduced me down to 10. I get scan anxieties just like any other patient when I have to do the checkups. Am I okay? And the rest I leave in God's hands. One thing that happened is that I became a breast cancer advocate. You can find me on YouTube, LinkedIn, Instagram, Facebook, Talks with Dr. D, where I advocate for all breast cancer people, our communities that support us. and the caregivers. And I give great information on what's new, and I chronicle my journey, and I've interviewed people who benefit the breast cancer community. So as I will tell anyone with breast cancer or any other cancer, fight the good fight, ask for a second opinion, don't be afraid to ask any questions, and use all the resources that you can, and it's a village that will get you through. This is Talks with Dr. D, Dr. DeCoteau, signing off. Have a great one.